Inner Voice, a heartfelt chat with Dr. Foojan.
Listen up if you want to promote your personal growth and self-awareness. I found the Foojan app last month and I have been absolutely loving it. I personally have never learned guided meditation, but thanks to this app, I now have learned incredible tools for my own stress relief and emotional self-awareness. Not to mention, there are self-evaluation tools and professional coaching available to utilize however your journey to self-discovery takes you. Join Foojan today and redefine your life one step at a time.
Do you wish to wake up one day and hit the Life Reset button? Life Reset, the awareness integration path to create the life you want by Dr. Foojan Zeine, helps you navigate crucial life areas, heal the past traumas, and cultivate fulfilling relationships and careers. Life Reset is your guide to a profound journey to...
Well, welcome to the Inner Voice, a heartfelt chat podcast. I'm your host, Dr. Foojan Zeine, a psychotherapist, an author, and the creator of the Awareness Integration Theory. So thrilled to have you join us today for what I promise you. It is a delightful discussion, something that is really close to my heart. So today I chat with Michelle May. She's a licensed professional counselor. She's the chair of the Intensive Short-Term Dynamic Psychotherapy program at the New Washington School of Psychiatry in Washington, D.C. She's a psychotherapist and a supervisor specializing in intensive dynamic therapy with a private practice for adults and couples in Virginia and Washington, D.C. We will be talking about her book, right? We talk about very refreshingly honest, illuminating, and emotion-provoking book. The name is What I Couldn't Tell My Therapist. It's both a precious resource for therapists wishing to do more for their clients and a guide to accelerate healing for anyone who's suffering and is going to therapy or wants to go to therapy. I think the beauty is that we were both therapists and we've been clients also in therapy. So we come from two different backgrounds of psychotherapy models. So we kind of were sharing what was, a joining factor about what the therapy sessions are and, what the joy is and what we go through. And if we really wanted to deeply work on ourselves, what really matters. So I definitely enjoyed it because it just hit so much home for me. And I'm positive that you'll enjoy and gain something out of it. Again, whether you are in therapy, whether you want to go to therapy, whether you've been there and dropped out and possibly could go back, or you're a therapist and find yourself in our conversation. So please hang out because you're going to really enjoy this conversation. Now be sure to subscribe to my podcast, my YouTube channel, and connect with me through my website, foojanzeine.com, any other social media platform, and share your thoughts with me. I actually love to hear from you. And don't forget to go to Foojan app and go over 32 different areas. And we have the AI chat bot called Mira, which she's there waiting for you to answer any of the questions you have from an awareness integration therapy perspective for you. So it's exciting. Not only the app, it's, we were looking at it and looking at the effects of it, and people were having between 60 to 70% improvement in their life in different areas. And that's just exciting to have that. And now you have a companion that not only you go through this guided journaling, but hey, now you have someone to ask questions, and Mira will answer you from the perspective of the awareness integration. Now, without further ado, here's Michelle May.
Intentional Parenting, a practical guide to awareness integration theory, written by Dr. Jafari, Dr. Foojan Zeine, and Dr. Manoukian, three experts in human development, is your step-by-step guide to raising a healthy child prepared for a culturally integrated world. You're supported in parenting infants to adolescents using the latest evidence-based scientific research on parenting. Order your copy on Amazon now.
Eliminate stress, reduce anxiety, and decrease depression. Dr. Foojan Zeine's Awareness Integration Theory has helped thousands like you get incredible life-changing results. The Foojan app gives you her evidence-based treatment in the palm of your hand. Download today.
it is such a joy to have you. Michelle May, everyone. She is the author of What I Couldn't Tell My Therapist and the Truth We Told to Heal Our Lives. It is so nice to have you, from a fellow therapist to another, from different parts of the coast, from California all the way to Washington, D.C. Hi.
Hi, thank you so much for having me.
Of course. So, what got you to write your book this way? It's awesome because it has stories, and we're story people, so people find themselves in it. But you kind of wrote the book from both angles, right? So you wrote it from the therapist perspective and looking at how we create the alliance and the relationship, and what are we thinking about as we're wanting our clients to have the best and heal and gain to their goals and all of it. And then you also write from the person's perspective of when they come to us because they need something, and the process they go through. So what got you to want to write this book?
Well, I was sitting in a therapist's office as a client, and I was getting therapy for medical trauma. And she said to me at the end of a session, she said, "You should write a book." And I said, "You say that to everyone. Like, everyone has a story." Like, I completely just, ugh, you say that to everyone. And she said, "No, I actually don't." And I really started to think about it. And I said, "You know what? I'm just going to give this a shot." And so I wrote a completely different book than What I Couldn't Tell My Therapist. But it wasn't until I wrote that completely different book that I said, wait a minute, this first book is told by my defense mechanisms. This first book is really this protective mechanism, and it isn't really that real. And so I said, oh my goodness, I broke out into a sweat. I'll never forget it. I broke out into a sweat when I realized I had to tell my real story, and that I also wanted to not make it about just me. I wanted to make it about us. And so that's when I thought about including two of my patients within it, and then braiding our story together to really highlight the we-ness of the problems that so many of us face.
Yes, absolutely. And I get that as it really resonates with me also as I'm aging. I've been a therapist for almost 32 years. So I started working with young people when I was young, and as I'm aging, the group that are coming to me are more also kind of my age. So we keep sharing different phase of life matters, that you go from one century to another, or one decade to another, or one phase of life to another, and you really get how there are human conversations that we all kind of share in a different way within our own stories, but it's so collective. And how much of this concept of it being collective is also healing, that we're not alone. I'm not only going through this, but if we're going through an illness, if we're going through something, or even an anxiety that is in our life, a situation, a depression, menopause for many women, aging conversations. And this, when you take the we-ness, who we are, collectively supports each other within our relationships.
Yes, absolutely. It reminds me, someone said to me once, God, I want to make sure that I'm totally unique, but like everybody else. Mm-hmm. And I said, well, you're in luck, because that's true, right? We all have our absolutely unique stories, and yet it all boils down to sometimes what I call like the one disease, which is if we were not seen and understood and felt exactly as we are, we develop inevitably problems when our humanity can't come out in connection with other. So it's very true that we-ness is such a healing factor in and of itself.
Is it also true that can we ever throughout our lifetime be always seen and heard and
No.
and I think that's the part of what we wish to have. And I think part of the conversation shows up as everybody thinks, oh, I'm the one that didn't get it, but my neighbor did, my friends got it, and I just don't know if that's reality, that at any, I know that there are times that we are seen and heard, and there are times we're not seen and heard. And obviously, there's more trauma when we're kind of neglected on all around, and we never
Right.
do that.
Right.
I think that it's important for our audience to also know that the fantasy or the utopia that there is someone out there on the face of the earth, that they really got the right parents and the right teachers and the right mates and the right stuff that are always going to be seen and heard and understood, is a little bit of a fantasy.
It's a 100% pipe dream. It's I was talking to somebody and they cited some research that I can't remember now that said that a good enough therapy will really be, the therapist will be attuned to the client a third of the time, right? So we really only need a certain level of attunement to feel seen as we really are. And it just really speaks to the importance of repair, because that's really where a lot of the magic happens, right? If I'm not seen, but then you can come back together with me, yeah, we're fine. We don't need, and it is impossible to get 100% attunement. It just doesn't exist. Not even close to 100%.
I love it that you gone through your own therapy and brought that and accumulated both of the sides together, because I know that I learned to be a good therapist by being a good client.
Yeah.
And kind of going as a client to see therapists with different modalities, because I think if each modality brings some kind of, approach and changes. And I even changed the therapist for the different genders, because I knew
Mhm.
that my issue was going to get cleared with my female therapist, and my daddy issue was going to get cleared from, the male therapist. And it was such a different experience when I went to different modalities and different people, but to allow myself to really like take in and go in and learn, because every time I learned, I brought that into my therapy room. And I'm not assuming that what I go through is what everybody goes through, but at least I had an experience of a possibility of what someone can be going through, or what it was that it made them vulnerable. And when I went from vulnerability to strength, I knew at least one path to share people personally, not only from a professional place. What was your experience being the therapist and then being a client?
Well, I think it brings up the important point that research has not found one superior type of therapy, right? That sometimes one therapy is better for us at different times and different clients and in different therapists' hands too. But I had seen for little short periods different kinds of therapists before probably the age of, gosh, late 20s. And none of those therapeutic experiences, maybe except for one, was helpful to me. Instead, they were unfortunately experiences of learning how not to listen, right? So, for example, I remember I saw a therapist and I would talk, I'm just making up an example, like, oh my gosh, I love cats. And she'd say, it's so great you love dogs. And I'm like, okay, this is what not to do. But my much more quality therapy as a client came only after I actually started my own private practice as a therapist. And I saw a therapist who specialized in intensive short-term dynamic psychotherapy. And I specifically sought him out to learn this modality because it's unique and you really need to know what it's like sitting in the client chair. And my mind was blown. It was unbelievable. It was so humbling. And I remember I walked in there and my wish, I said to him, I want to learn about my blind spots and I want to learn about all of my unconscious dynamics and all of my defense mechanisms and how my anxiety hides, which of course only a therapist says to another therapist, right? But it was sensational. And interestingly enough, after I think 4 years in that therapy, I realized that even a really good therapist has their limitations, and I ended up stopping and seeing a different kind of therapist that didn't do ISTDP. This was actually the medical trauma therapist I mentioned earlier, and it was like, wow, this is so incredible how many types of therapy really are helpful. And getting all those different flavors really makes you a better therapist. And also, like I said earlier, in learning, oh yeah, I don't want to do what this person did. That didn't work for me. Remember, do not do that. So I had a lot of different experiences in therapy that all brought me where I am today. And it sounds like you did too, just a big mix of all sorts of different types.
I went to a school which was human existential. I started my own therapy with couples therapy, which was, a whole different concept. Then my supervisor was psychodynamic, so I really learned like personality reconstructions. And then I went to groups where they were just doing solution focused and more positive psychology. So I was getting from all
Oh, wow.
cognitive. So I actually brought everything, and then trauma, hypnosis, EMDR, everything. I brought everything together, and I did create my own model, which is awareness integration, that gets all of those from every area. But I've just loved going to different modalities and learning, the cognitive, the emotional, the body, mind, the energy work, the tapping work, the, everything. And it's a rich way to look at things and go from any door inside. And for people who, I'm assuming that our audience and are listening to us is because they are the type that really love to reflect. They like to get to know themselves, and be responsible for who they are. And I think all of these different ways of looking at things and looking at ourselves just opens us to not only our deepest pain and vulnerabilities, but also the ways of resilience and gratitude and, feeling one with ourselves, with us as people and the bigger concept. So I really, really enjoy this path. I was very depressed and anxious all my life. I've been through a lot of traumas, and I could tell you that, therapy has saved me. So I went back into becoming a therapist because that was one modality that I think that it really helped me. So I really honor, people who, work on themselves. Out of working on themselves, they also choose this path and, then, try to create this path for everyone else. So it's not an easy path to sit with everybody's suffering, but I also think it's a beautiful when we watch ourselves and others go from suffering to healing. I think that's a beautiful space to be.
It's very true. And it makes me think about when I remember in the beginning of me being a therapist, my family would sometimes say, like, well, aren't there any clients like you can't stand? Like anyone you don't like? And I'm like, well, let's think like about it this way, is that anyone who walks through our door has one of our favorite traits, right? Which is curiosity about the self, ability to look at oneself. Like that in and of itself is enough to gain my respect. So there really isn't one person that crosses through, my threshold that is not somebody who automatically has my respect in that way. So it's a very similar thing of just really admiring people who really decide to sit on the couch and do the hard work of not just understanding themselves, because understanding ourselves is actually a little bit easier than feeling ourselves. But feeling ourselves underneath all of our protective barriers is a whole nother dynamic. But it's just a privilege, this job.
So your book says what I couldn't tell my therapist. So would you like to spill the beans? What is it that you can tell the therapist?
Well, this title, it's amazing. It came together at the last moment. A lot of people figure out their titles immediately. For me, it was the last thing that came together, and I'm so glad it happened in the way that it did. But I'm a fan of double meanings. So there's a couple of different meanings in this title. One of them is a little bit more what you might imagine, right? Which is that what we consciously withhold, what we don't want to share because we're afraid that we will betray the people that we love, or that we will humiliate ourselves and our therapist will judge us. One of the themes is talking about our families. People are like, I don't want to blame our family. I don't want to blame my family. I'm like, that's great. We shouldn't blame, but we do want to understand causality, that oftentimes A and B does lead to C. But yeah, we can't blame your mother or your father because then we have to look at their parents and then their parents. So part of what I couldn't tell my therapist is the secrets that we were told to keep. And the fearing of betrayals of our family. But the deeper meaning that was even more important to me in terms of what we can't tell our therapist, or what I couldn't tell my therapist, is what we can't also tell ourselves. So I could not have told my therapist that I was sitting on a mountain of rage and guilt. I could not have told my therapist that I had a 6-year-long headache that traumatized me so deeply, I still couldn't tell my elbow from my knee. I couldn't tell my therapist about my real childhood because I couldn't tell myself any of it yet. So that is really what the title speaks to, which is the need for the therapist to have the kind of training and insight to help us see the ways in which we hide from ourselves, so that we can eventually tell our therapists and ourselves, most importantly, the truth about what we've been through and how we feel and who we are.
Very true. I think that, I've worked with addiction for such a long time, and I saw myself as an addict of cigarette smoking. I, didn't get involved in drugs, but definitely, cigarette and food and all those things.
Uh-huh.
And I can really see that dynamic of what you just talked about also in the addiction dynamic, which is, our brain kind of lies to ourselves on so many layers. Or, I went through sexual abuse as a very early child, and part of it was not allowing myself, like the relationships that were not hostile and, were more with people who were loving to me, nevertheless, not appropriate. But those are the areas that it was, for me, it was like I prefer to hold on to the image of love that I had versus give it the concept of this was inappropriate, or not knowing how to create boundaries, or not knowing how to set up those boundaries as I would freeze. Those were a lot of these things that I couldn't tell myself. And it took such a long time before I could actually face those areas of myself, because facing those areas meant I had to make some choices about behaving a different way, externally. And when I was used to the way I was behaving to, any type of behavior has some obviously benefits, which is sitting down and really figuring out the benefits that I was gaining was not as much as the cost I was paying. So, and this is what we get also in addiction recovery, to really thinking that the benefit, although it appears to be so amazing, it's not. The cost that we're paying is so much more. So it takes time for anyone internally to even get convinced and open themselves up to the mirror that is in front of them, and take it in, and not take it in with self-blame. Sometimes the self-blame comes, but take it in and honor themselves for whatever they went through.
I'm really glad you brought up things like smoking or food or other substances, because that really does go right in the category of what we usually can't tell our therapists. We think we're honest, right? What I couldn't tell my therapist was that I was having a love affair with Percocet, and that I was so attached to it because it was the only thing that would help me live my life when I had a headache that wouldn't stop for 6 years. I couldn't tell my therapist that if he would have even tried for a moment to tell me not to take those pills, I would have walked out. Right. I could not. There were so many things, right, with substances, especially, that things go underground because they're so precious to us. They're absolutely, for a lot of us, they're the best mom and dad we could have imagined, because they were so much better than the comfort that we received. So all of this goes underground into what we can't tell our therapists, and most importantly, what we can't tell ourselves.
One of the things that I come across a lot is for people to shy away from telling me that they have thoughts about dying, and they set up, because they know that we are going to obviously intervene and report and, possibly hospitalization. And many of them, they just won't. They've been having that, thought for so long. They've been thinking about it, planning about it, but they just won't share it. And it leaks out And, as I've become a little bit more seasoned, I'm picking up the leaking out, and I'm not freaking out as they leaking it, because if I freak out, they're going to freak out and never say it. And, and even addiction, I've noticed that the same thing is, for a while, as you recall, for addiction recovery, at one point we wouldn't see anyone if they were still using. So the industry changed, and obviously, if I said, well, and I will only see you after you quit, people wouldn't show up anymore, because
Right. We wouldn't have a job.
right, like, because they didn't want to come.
Right.
So this opening of, it's okay, let's look at it. What is your goal? And some of them, like you said, they would come in and say, don't even go there. Like, don't even talk about that, because
Mhm.
and it's like, okay, we're going to talk about all the other pieces. And sometimes it took 10 years when when we cleaned up all the other pieces, where the person finally said, all right, I'm ready to take this on. But there is a lot of times where people really want help. And as they come in, that part of them is protected. A part of them is so protective of the things they don't want to change yet. So they'll put in all of the other pieces on the table. And for us to be able to not only see it, recognize it, and sometimes miss it until they're ready to show it to us, and then slowly but surely, having the person to get there if they get there. But at least still I think any of the process is still helpful. Sometimes they'll come up back and forth. They'll come in for 6 months, they go away, they come back, because now they're ready to work on something else. And I think that by itself is a great process. And not think that I didn't go, it's not a one-time deal. I don't think therapy is a one-time deal anyway.
No way. Yeah, no way. I think it's unusual and cruel punishment to actually work on taking away somebody's substance, whether it's alcohol, vaping, cigarettes, food, opioids, without addressing the cause for the need of that comfort. It's and that's often why, like you're saying, someone won't put it on the table at first and then will put it on the table later, because we've done enough work to help them feel as if maybe they could live life without this, or live life with it less in their bodies. But we really have to address the original need for that substance. We have to help people gain the emotional capacity to face life and reality before we start ripping away the very thing that often actually kept them alive. We don't often talk about that because it sounds kind of taboo to say, oh my gosh, but for me, I know my opioid saved my life for sure. And I would not be here, at least not in this capacity, without them. And so I was so grateful to everyone's patients around me, especially my ISTDP, or intensive short-term dynamic psychotherapist, who really knew to let the process unfold naturally and help me gain the capacity to say goodbye to them, and not being premature about taking away the substance before I address the reason for the substance.
Absolutely. So what do you want or intended for the readers to gain when you wrote your story and other people's story in this book?
My story is so much for those people that have lost hope. They have possibly unexplained physical pain that their doctors have said, we don't know how to help you, or we do, but none of those things have worked. My book is for the people that have been to therapy and kind of been, this didn't do much. This is a Band-Aid when I need a heart surgery. My book is for the people that think they're so aware, but still aren't experiencing relief from their anxiety, depression, substance abuse, physical pain, whatever it might be. The book is really meant to illuminate what's hidden from ourselves, so that people can finally realize, wait a minute, this isn't who I am. These are barriers and shields I've learned to put up in front of me. And I'm sure, as you well know, most therapists are actually not trained to see unconscious processes. Most therapists are not trained to monitor anxiety moment to moment. And so the book was really to give hope to those people that feel like they've kind of gotten to the end of the road or are starting to think about getting to the beginning of the road and are too afraid to do it. This gives them an insight into what a real deep therapeutic process can actually look like.
I'm going to put you on the spot. What does deep therapy look like from your perspective?
So it requires a couple of different things. It requires a relentless loyalty to the truth for the sake of the patient. There are a couple of different ingredients that need to be within the therapist. And that's another thing. It takes an incredible amount of postgraduate training, which is why I think there's not a lot of training like this. You know, a therapist has gone through graduate school, they've already done so much, you know, leave me alone. I just want to have my practice kind of thing. But really most of our good training, again, as you will know, happens after graduate school. So we need to be able to assess anxiety. So if I have a patient that comes in and sits in front of my office, I am watching them from head to toe to see what their body is doing. If their body isn't moving at all, something's wrong. Because it either means no one's relaxed coming into therapy, right? If they're relaxed, it means that they either aren't intending to do hard work, that there's a defense mechanism so dominant inside of them, but they don't see it. Or there's actually a bigger problem. Maybe they're on a lot of medication, or there's been a traumatic brain injury or something like that. But intensive dynamic therapy really involves getting a very clear consensus on what you're doing together, and permission from the client to share what you are seeing in the moment. So do I have your permission that whenever I see you doing anything that could contribute to the reason you're here, can I tell you? Do you notice how you're looking away from my eyes? You're here to get help with intimacy with your wife. But as you sit here with me, you tell your feelings to my plant. What feelings come up towards me as you look at me? Well, I don't really have many feelings. Exactly. Would you like to see what feelings you're hiding so that you can be close to your wife? So there's this really consistent addressing of what you're seeing in the moment while monitoring anxiety levels, while monitoring the amount of desire a patient really has to do the kind of hard work, and really essentially cracking into the unconscious so that you can get to the core of the problems and not just treat the symptoms, but really get to the core of why somebody doesn't look at me and they look at the plant instead. It's a big question, really, intensive short-term diet. It's such a robust kind of system, but it really breaks down to assessment in the moment, response to intervention, really tracking moment to moment and helping a patient just reveal what they've been hiding from their whole life so they can face it and experience freedom.
And it takes a lot of safety to create that. So for the therapist to create that type of safety, although it's very confrontational. So I know that it's like an oxymoron conversation that I'm having, but it is true and it does happen where you could definitely confront what is in the utmost level of safety. So that the person can kind of drop the veil that they're holding on and dear life. And sometimes they were just used to it. It's sometimes a clear confrontation or allowing the person to see, it would drop it immediately because they're like, what's the point of this? And sometimes,
right, all they needed to do was see it, maybe.
Yes. And sometimes they'll see that they're not willing to because they're attached to it so much.
Exactly.
No, I'm not giving this up. And then they look at what it is that they're not willing to give up in that way. And I also think what you just shared, it takes a therapist who has clear boundaries, because a lot of times when you're creating, sometimes therapists can physicians, doctors, therapists can hold themselves behind this concept of the expert, which is they come to us because we're an expert and we're sharing with them what we know from our knowledge. But there's also the other angle where it becomes about this relationship itself, as if what we're doing in the therapy sessions are kind of a microcosm of what's happening out there. But if we're going to bring the experience of what we're happening right there into a space, then it also becomes about the people who are sitting here, and then the boundaries, holding the boundaries sacred and appropriate for all of it to be able to be utilized as a practice, as a laboratory, as something to be seen and then taken, and then associated with what's ever happening in their life with, all their relationships out there, whether it's work or intimate relationship, children, or anything about themselves.
Exactly. Yeah. Because there's so much working in intensive therapy, there's so much working in the relationship. That is, if the patient's body feels comfortable enough with it. And making those parallels, like you're saying, you look at the plant instead of me, and this is exactly what you share, you're struggling with your wife. And you've also mentioned that your mother and father really weren't close to you. So you're making those parallels between the three. And in order to work with some of those really deep emotions, right, like rage and sexual components and guilt, you need a really, really safe environment. And one way to communicate to somebody, hey, you're allowed to have whatever feelings, not actions, but whatever feelings and beliefs and thoughts and opinions in here with me, is by demonstrating to the client that you're curious about all of it. So for example, when I ask what feelings are coming up towards me, I'm communicating, you have feelings towards me. You're allowed to have feelings towards me. You have more than one feeling towards me. And we care deeply about what that is. You don't have to protect me. So that's a really important component of healing. Otherwise, you really can't get very deep into things.
I remember even doing an intervention at one point, which I thought it was doable and it was appropriate, and it didn't sit well at all with my client. And then, so hopefully that our relationship was strong enough that she had the ability to come in the next session. And she was so afraid to share with me that she didn't like what was happening. So she was kind of like, pussyfooting around all of these conversations in order to tell me, and finally opened and, said that just didn't sit well with me. And, and I said, I apologize. I made that up because I thought it was working at that moment. And I chose to make this intervention because I thought it was going to work, and I was wrong. I apologize. And I'm so happy that you're sharing with me that just didn't sit well with you. And then she shared about, I thought your intention was such and such. And I said, and I'm sorry if I gave you that idea. Can I share with you what my intention was? And she said, yeah. And I shared with her, and she goes, oh, okay. No, I can handle that intention, even though I the behavior. I said, yeah, that was the intention. And although the behavior or whatever, however it landed on you, didn't land on you appropriately. But it was funny because then 2 weeks later, she had done the same type of like boundary setting or intervention that I had done with her with other people. And she realized that she's done that so many times before. But she never realized, as someone who's done that intervention or behavior with other people, and everybody else got furious with her too, and then she made them wrong, that this interaction between us opened up a whole different level of that she was on both sides of it, right? So she used to be the one who set these types of boundaries with other people and got everybody enraged and always made them wrong. And then this time, because I had set that boundary, she got enraged. But for the first time, she was able to talk about it, and she got to be on both sides.
Wow.
Of the whole thing. And it was really amazing of this type of an experience that she allowed herself to go through, and had the courage to come and share, and had the courage to now, have this ability to look at all around. And I think it's so true, Michelle, that we do it all as a human being, right? Like we can be on all sides of this. And sometimes we realize, we could be an angel, and we could be the devil, and we could be, the sweetheart, and then we could be like the utmost level of jerk, and we could be all of it. And from every angle, we have our own justifications, but from every angle, when you kind of allow yourself to experience, then you get a bigger picture of who you are and who humanity is overall.
That's right. We are everything, right? We are everything. And knowing that there is no bad other is one of the hardest things for us to do, especially if we've been deeply wrong or deeply hurt in cases of, abuse, neglect, etc. But yeah, we are everything. We're the bad, we're the good. And earlier you had mentioned kind of sometimes therapists taking like a one-up position, and not a lot of deep healing can come when we act or behave as if we are holier than thou or somehow deeper experts than we really are. So yeah, it is so important. It really goes back to this we-ness, this collective experience of just being human.
Anything we haven't shared that you really want people to know?
Goodness, I think that a common misconception is that we can know everything about ourselves, right? Like people say, I'm so aware. In fact, I'm too aware, right? You hear this a lot. And of course, what that often means is just someone's a little too in their heads. But there's always room to discover more about not only yourself, but the other. So if we think about our therapeutic journey or our psychological journey or our whatever journey about reaching some kind of an end point, then we're going to needlessly suffer. So there's really always something we're not quite clear on. We don't have to get clear on everything. That's impossible. But really knowing that we're an endless mystery is something that can be quite liberating if you can accept that reality. And so that's a lot of what I couldn't tell my therapist is about really accepting what we do not know and being human.
Yeah. It's amazing what you said. Yes, it's true. Even the same traumas that I had worked for, almost 30 years in different therapies. And I thought, I got that one. I got it. Like I healed every angle. And then suddenly something triggers me and I allow myself to go through the process and, go through the memory and this angle and all of that. And then areas show up for me. I'm like, wow, that piece was still there.
Yes, that's a great way to put it.
And then sometimes it's not that we didn't catch everything. It's because I'm older and because I have different needs right now. Now that I look at that memory, another part of that need shows up, which I never knew, when I went through it when I was 20, because when I was 20 and looking back at my 20 years, I only looked at it from an angle of a 20-year-old. I'm 62. From an angle of a 62-year-old, now I look at the whole thing again in a different realm. So it's amazing how we keep looking at our life procedures and things that have happened, the belief systems, the story, and at every era, we really have a different angle of the whole thing. So this concept you shared about curiosity is like as long as we hold that curiosity about ourselves and others, life is never boring. It's like it's interesting every minute.
Exactly. That there's always a different angle and we can't always know every angle at the time. We have to just remain open to that changing and shifting.
Yes. Everyone, what I couldn't tell my therapist, The Truths We Told to Heal Our Lives by Michelle May. Well, it has been an amazing conversation of the two of us from two roles, right? Client and therapist.
Yes, exactly. All of it, everything.
Michelle, how can people find you?
They can find me two ways. One is through my website, which is MichelleMMay.lpc.com. That's Michelle with two L's. May, M-A-Y, LPC, as in licensed professional counselor. So that's MichelleMMay.lpc.com. And you can also find me on Instagram at MichelleMMay.lpc.
Beautiful. It was a joy to talk to you.
It was such a joy to talk to you. I could sit here for even longer. Thank you so much.
Take good care of yourself. And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week, bye-bye.
Are you a psychotherapist looking to enhance your practice? The Awareness Integration Therapy developed by Dr. Foojan Zeine is a comprehensive guide to the principle and techniques of this powerful therapeutic approach. Join the growing community who have elevated their practice and expanded their skills by embracing Awareness Integration Therapy and witnessing its life-changing impact. Order your copy on Amazon now.